We're joined here today by Katy Jon Went, a social justice champion who has spoken at length about issues concerning gender identity, sexuality, diversity and inclusion. In light of today's CAS review, which has found that children have been let down by a failure to base gender care on evidence-based research, we are here today to gain further insight on the issue. So Katy, thank you so much for joining us. Our first question is, how do you think the CAS review's findings on inadequate research and evidence-based practices in gender care will affect health professionals' ability to support local citizens, including young people questioning their gender identity?
Well, I think that the biggest issue is that they're going to be in a state of confusion because they've had petitions against them, kind of like people clamoring at their door for greater gender identity services for years, and then for a report to essentially put the foot on the brake of that doesn't make the children go anywhere, the teenagers go anywhere, or the need disappear, unless you're actually going to transfer and increase the funding and the resources and the professionals into CAMS, child and adolescent mental health services, which are terribly underfunded, under-resourced, and take, almost as long a time to get into them as it takes to get into a gender identity clinic. In other words, it doesn't solve the crisis in young person mental health distress. And that's the thing that needs to be kind of plugged. And then to see gender identity, gender dysphoria, whatever you want to call it, gender incongruence, as one component of that young person mental health crisis. And then to recognize that, waiting lists for an ADHD assessment, waiting lists to get into an eating disorder clinic or program, or self-harm support, whatever it might be, those things all need as much support and need to be kind of have that equitable kind of balance with physical health conditions, whereby there is a maximum 18-week wait rule, whereas any aspect of mental health is typically more like 18 months, and sometimes it's 3 years, whether it's gender identity or an autistic assessment or something like that. So that's the biggest problem, is it's not going to solve anything just putting the brake on it unless you plug the gap of resourcing around mental health in general.
Yeah, no, certainly. And also the whole notion about how, a holistic assessment of the individual needs to be done. I think that's also especially
100%.
important. It was refreshing to hear this morning a more sensible, moderate conversation about gender identity services from politicians like Yvette Cooper, as often this issue about gender identity is very politicised and there's culture wars all about it. But how do you think policymakers can ensure that the CAS review's recommendations are implemented to prioritise the well-being of young people, steering clear of these cultural wars that have often been overshadowed these issues?
Well, that's exactly one of the things that Hilary Cass talked about from, the early version of this, the initial thing in 2021, 22, to this report now, to this review now, has been the whole toxicity of it. And I think she described it as a stormy social discourse and completely kind of polarized. And the problem is, again, this doesn't solve that. No one's going to kind of find the small print in there where she has called for, let's come to like a shared consensus where we put people's well-being first and young people get to make informed choices. I mean, one aspect of malinformed choice was the fact that even my own surgeon actually went to Tavistock and Portman and actually said to them, look, the parents and the children are not being informed about what happens if they do go down the path of, for example, puberty blockers, back when they were allowed, was that they wouldn't then necessarily get enough physical development to have the material to even have surgery as an adult. And Hannah Barnes talks about that in her book, Time to Think. And so some of these flags were raised beforehand that there wasn't informed choice going on. But the very fact that Hilary Cass does have empathy and humanity in the way she has expressed this is not the bit that people are going to pick up on today. The report is already, you only have to go on Twitter to see it's being condemned by trans activists and praised by gender critical activists, many of whom are saying it still doesn't go far enough. Because and one person has gone on to say Hilary Cass still allows for the fact that gender dysphoria exists. It's rubbish, or they're all AGPs. So the polarization hasn't stopped because of this. Right. What we need is to magnify her call for a moderate, holistic, humanity-centered exploration and support of young people's distress and needs. And as I say, that is a funding gap, but it's also an empathy gap that exists in society and exists within this polarized debate around it. So finding, yes, the sensible, rational, reasonable, moderate voices, but more than that, I don't mind if the voices are extreme too, or if the voices are very strong on one side or the other. Within that, at least find the common empathy for each other still, recognizing that the gender critical activists are coming from their positions, the trans activists are coming from there, but each of them are doing it because of a belief, because of an experience, because of something that they hold true and dear. Even if you disagree with it, you don't have to agree, but can you agree to dialogue? And don't get me wrong, gender critical people were calling for dialogue 8 years ago, and trans people were saying no debate. So that was a failure on the trans side, or at least on some of the major trans organizations like Stonewall and Mermaids. We should have debated, but without the argument that our lives are not up for debate. It should have been a discussion. It should have been a dialogue. It should have been a conversation. And any of those conversations that take place should have had at least 5 voices there, not just the 2 sides like this, and not just the person in the middle, a bit like me now, but also the moderate people on either of the extremes as well, so that you can hear from a multitude of voices and not just have a ping pong match, which is all it's been for 8 years, which has just got more and more vociferous and visceral and virtually violent now.
Yeah, and I think, alongside empathy, it's also important to recognise it as an issue of healthcare rather than of, I'm voting this way and I don't agree with this. Do you think that these findings necessitate a reassessment of Labour's policy position? So especially regarding their plan to expedite processes related to changing one's sex?
This goes back to the idea that, if one party says one thing and holds to one thing, it is impossible to hold any nuance or the other opinion. I believe that in all forms of politics, there needs to be more people crossing the floor of the House to say, actually, the person on the other side says something rather sensible right now, and I'm going to agree with it. I don't have to agree with their party, their policy, or anything else, but I can agree with that statement. But there's this tribal loyalty that says everybody in our party, our campaign, our activism has to believe the same thing. And we've seen this kind of language policing within both trans activism and ultra gender critical activism, and purity policing. You must believe this. And so not allowing Labour MPs to have independent minds, not allowing them to kind of, hey, I disagree with that, I agree with that, and to actually say you should be expelled because you don't hold the right viewpoint on Israel, Palestine, etc., anti-Semitism, Islamophobia, or you don't hold the right viewpoint on who or what is a woman type thing. There should be room for what in conservative terms used to be called a broad church, and to have that flexibility of opinion within it. It was F. Scott Fitzgerald who said the sign of a great intelligence was the ability to hold 2 truths simultaneously, which might appear to kind of even contradict each other, and to hold them, as my friend and neighbor Linda Bellos, a former Labour activist as well, used to say, hold them open-handedly, hold them gently, hold the truths gently, because some things, that's why I've always done the same thing around gender identity and puberty blockers and transitional things, because some evidence comes to light later that that's not the best route. So if you go down lock, stock and barrel, this is true, and then find it unravels later, then you look like an idiot. So hold things lightly, don't jump on a bandwagon, and create the space for discussion and dialogue rather than create the space for a new doctrine.
Yeah, great. Well, thank you so much for taking the time to speak with us today, Katy. It was really insightful and you've shed invaluable light on the situation.